Hi, my name's Joseph from Mental Health Europe, and today we're going to be discussing the European Pillar of Social Rights and how it relates to your mental health. When mental health is discussed, it's often brought up as something that is caused by individual characteristics. But the reality is, it's shaped and impacted by the social dynamics that exist in your life, from your job, housing, the income that you receive, and so on. Mental health, as much as anything, is a social thing, and therefore relevant when we discuss social rights. But what exactly are social rights? Social rights are human rights. They are fundamental to dignity and empowerment and include access to essentials such as food, health, education, housing, social protection, and labour rights. However, specifically in the European Union, social rights get a more important dimension in EU policies across Europe, with the adoption of the European Pillar of Social Rights. Though the EU cannot itself directly adopt social policy for member states, the pillar allows for a benchmark and guideline toward a better and brighter future for all. The European Commission had set forth an action plan, ending in 2025, with 3 targets that are to be achieved by 2030. These targets are a 78% employment rate, 60% of Europeans should have attended some form of professional training each year, and a reduction of 15 million in the number of people at risk of poverty or social exclusion. But what does the pillar actually look like? The European Pillar of Social Rights is divided into 20 different principles, each grouped into 3 key areas. These areas are equal opportunities and labour market access, fair working conditions, and finally, social protection and inclusion. The first, equal opportunities and labour market access, covers your social rights that relate to access to such things as education, work, and equality of opportunities, otherwise known as non-discrimination. Secondly, fair working conditions. This relates to your social rights connected to how you experience employment, such as job stability, healthy workplaces, and work-life balance. Finally, social protection and inclusion covers a much larger number of principles, ranging from access to quality healthcare and other services to social protections, such as unemployment and housing protections. So why are we discussing social rights? How do these apply to mental health? Well, as mentioned earlier, our experiences of the many issues we can face in society will impact our mental health. This means that if you find yourself in a situation where your housing, job, or access to quality care are at risk, you run a greater chance of developing mental health issues, of becoming vulnerable to addictions, such as opioid use, or of falling ill. This is why we advocate for moving beyond a narrow biomedical view of mental health, and rather adopt a psychosocial approach, one that explores these social dimensions of a person's life. So how does this impact you at all? Well, it's important to remember that mental health is a shared social issue, not a uniquely individual responsibility. When society supports your rights, your mental health improves. And when your mental health improves, you can more easily live, work, connect, and thrive. That's why it's time to see mental health as a social investment. Your mental health doesn't exist in a vacuum. It depends on your rights being protected and respected. So let's treat mental health as what it truly is: a human right, a social right, and a shared responsibility. If you found this video interesting, consider leaving us a like or a comment. If you'd like to see more, check out the rest of the Beyond the Label series on our YouTube channel.